Good afternoon, everyone, and welcome to today's COVID-19 update. With us today is Health Minister Tyler Shandro, Municipal Affairs Minister Rick McIver, and Chief Medical Officer of Health, Dr. Deena Hinshaw. Each will provide brief remarks, and then we will take questions.
Thanks, Christine. Good afternoon, everyone. Before I begin, I want to take a moment to honor the memory of Joe Correll. And Joe was a healthcare aide at the Bethany Riverview Continuing Care Facility in Calgary. He served residents faithfully in spite of the risk of COVID. He's an example of the strength of this healthcare system and the commitment of the many people who work in it. Joe is the first healthcare worker that we've lost to COVID-19 here in Alberta, and I'm very sorry to have to announce the loss of another continuing care worker. And we'll confirm in the standard data, but I can tell you that she was in her 50s and worked in the Edmonton zone. And our thoughts go out to all of the families. And on behalf of Premier Kenney and the government of Alberta, I just want to say to these two families, I want them to know that we thank these two people for their service to the province, and we join you in honoring their memory. The pandemic has brought too many stories of tragedy to too many families, but it's also brought examples of the hard work and commitment of the people in the healthcare system and the optimism that they bring to their jobs, no matter how tough these jobs are. Like the story shared by ICU nurse Tanya Harvey, who was one of the first to receive the COVID vaccine. Her hope is what we all need to hear right now, that immunization is, quote, going to give us back our families, our communities, our lives, our loved ones, end quote. It's the same hope shared by Irene and Arnold Pipke that they can get together with their family in August when they celebrate their 70th anniversary. Irene and Arnold are residents of the Hamlets in Red Deer, and they were immunized on December 30th. And I can't forget the incredible picture of hope that ICU physician, Dr. Simon Demermarcil, gave us as he sat for his COVID-19 vaccine, months after he shared a photo of himself calling a family to tell them that a loved one had passed away during the pandemic. And as you've heard me say before, the start of COVID-19 vaccinations means that we're starting the work of putting the pandemic behind us. Just about 3 weeks ago, we immunized the first Albertan. And since then, AHS has been steadily ramping up to use the supply of vaccines as we receive them, based on the priorities in our plan, starting with those who are highest risk of severe outcomes. And I want to emphasize, the rollout of vaccines is a function of the supply that we receive. AHS is doing a superb job of that rollout, and I want to thank the staff who are giving out the shots and the AHS management team. The staff are mainly registered nurses and pharmacists, and some of the nurses are new graduates, actually. And I think it's worth noting, in their very first job, they're helping to roll back the tide of the pandemic. And I'm pleased to announce that as of the end of the day yesterday, January 4th, we've completed more than 26,000 vaccinations. The exact number, I think, is 26,269. AHS did about 3,000 shots yesterday, and they're on track to do another 3,000 today. That means by the end of today, we should be at about 29,000, the initial goal that we set in mid-December. Now, it was an aggressive goal, and we're getting there only a few days later than we had hoped, in spite of the need to plan around delivery times and amounts that are consistently and constantly shifting outside of our control as a province, outside of our control as Alberta or AHS. These dates and amounts that are delivered are outside of our control. We're doing our best to be able to plan around what is constantly changing. And every province and every country is dealing with the same issues and adapting to them in their own context. The more important point here, though, is that we'll continue to ramp up when the supply ramps up as well. At this point, by the end of today, we'll have about another 5 days worth of vaccines in stock at the current rate. So the work will continue, and AHS will ramp up as it's needed. In fact, I was just told on my way over here that we've confirmed the next shipment is on its way. It's in the air as we speak. And I hope to see the daily number increase, but I emphasize again, it depends on when the shipments come. Our commitment is the same as it's been from the start. We'll get the vaccines out as soon as we get them in. Starting this week, Phase 1A will include immunization of healthcare workers in home care and emergency departments. In February, we hope to begin Phase 1B, which will see the immunization of seniors who are age 75 and older, residents age 65 and over in First Nations reserve communities and Métis settlements, and healthcare workers in medical, surgical, and COVID-19 units or operating rooms. We're also finding ways for our immunization program here in Alberta to be more efficient and to bring the vaccines to where people are. Alberta Health Services has launched an online appointment booking tool for healthcare workers. Now, this new tool is available to eligible healthcare workers by invitation only at this time to book their COVID-19 immunization from their phone or from their computer. AHS is doing everything they can to immunize as many people as possible with the available vaccines, including providing immunizations in the evening, on the weekends, on holidays, including the vaccines that they provided on New Year's Day. They're working across every zone to give the shots at more locations. There are currently 45 sites across the province, and more will be added as more vaccine becomes available to Alberta. AHS has been working closely with the continuing care operators to facilitate immunization on site of their staff and their residents. And finally, AHS is actively recruiting additional staff to join their team of immunizers. They've made a tremendous start at the work of protecting the most vulnerable Albertans and the most critical frontline healthcare workers. For now, though, it's up to us to continue to hold back the pandemic, and we're doing that. We're doing just that. We asked Albertans to protect the healthcare system by limiting their contacts and driving the cases down, and the numbers are coming down. To be clear, they're still too high. We need them a lot lower. And I don't want to jump the gun. The numbers from the holidays have some uncertainty in them because of the low number of tests, and there's a real risk of an increase due to the holidays. But we turned the corner on cases before Christmas, and lower case numbers have also changed the curve of cases coming into hospitals. They're still far too high, but they're flattening. And if we stick at it, they'll come down. I want Albertans to know the efforts they've made are worth it. We're on a bad course, or we were on a bad course in mid-December, and we've changed it. We're going the right way, and it's for one reason. Albertans are doing the right thing, and it's working. As Dr. Hinshaw has said, we are each other's vaccine as we wait for our turn for vaccination. Thank you, and I'll now invite Minister McIver to say a few words before Dr. Hinshaw gives today's COVID-19 update.
Thank you, Minister Shandro. And folks, at this point, I have been the Minister of Municipal Affairs for, I think, just under 30 minutes. I'm getting briefed on a number of files, but our government recognizes the critical work this department is doing, which is why I'm here speaking with you today. I'd like to provide an update on our outreach efforts to support communities dealing with significant spread of the COVID-19 virus. 9 of these communities are in Edmonton and 2 are in Calgary. COVID care teams are helping us reach across barriers to provide our communities with the information and supports they need to keep themselves and their families safe. In terms of financial incentives to self-isolate, I am pleased to report that as of today, around 500 rooms used by more than 500 Albertans, some with more some with more than for self-isolation accommodations, free of charge since we began to offer them in May. And as of December 15th, individuals living in the Greater Edmonton or Calgary metropolitan regions are also eligible for $625 in temporary financial aid once they have completed their self-isolation at a designated hotel. We will be in a position to provide the total cost of the program, both the cost of the isolation payments and the costs for the accommodations and meals in the coming months. At the start of the program last month, we established community tables in both cities. In Calgary, we are working with the Calgary Northeast Zone Partnership and other local organizations to reach out to residents in the upper Northeast and lower Northeast areas. In Edmonton, we are working with various community organizations and NGOs to reach out directly to residents in the target communities of Northeast, Northgate, Castle Downs, Woodcroft West, Jasper Place, Woodcroft East, Eastwood, Abbotsfield, and Millwoods West. COVID care teams have assembled over 58,000 care packages and have distributed more than half of them by hand delivering them door to door to long-term care and seniors residences through schools and via food hamper distributions since the program was launched in December. Language has been a key barrier for many of these Albertans to get the help that they need. That's why we have expanded access to translated materials and other supports. To date, information has been translated into multiple languages, including Arabic, Chinese, French, Hindi, Korean, Punjabi, Spanish, Somali, Tagalog, Urdu, and Vietnamese. Messaging is also being delivered in these languages through radio, television, and print advertising, as well as through various social media channels and web platforms. Collectively, through these efforts, we are ensuring all Albertans receive this timely information in the right way. I am so grateful for the support of the community resources, community organizations, cultural associations, translators, social workers, faith leaders, and settlement organizations who have partnered with us to provide localized expertise and to leverage existing relationships so residents in these neighborhoods get the supports and the resources they need. Collectively, we are putting our best foot forward to ensure residents have the understanding, tools, and supports they need to break the chain of transmission in their communities. Thank you.
Thank you, Minister. As this is my first update of 2021, I want to wish all Albertans a happy new year. I think we all look forward to this year bringing us closer to our old normal, and there is hope. We just have work yet to do to get there. I want to begin by addressing reports I have heard that some Albertans believe that doses of vaccine are being wasted or thrown away deliberately. It is important to address this inaccurate information that may be circulating online. We are working hard to immunize Albertans as quickly and safely as possible. Once thawed and brought to room temperature, the vaccine must be used within a few hours. We know this and have worked with AHS to put clear processes in place to prevent doses from being wasted. Each dose is thawed and then prepared according to pre-scheduled appointments booked online. AHS has been instructed to overbook appointment slots to ensure someone is always in line. In the rare case that there is a dose left in a vial and no patient is available, AHS will immunize the on-site staff to ensure that no dose is going to waste. In any immunization program, a small amount of vaccine will occasionally be lost when drawing doses or if a vial is dropped or spilled. Some human errors are unavoidable, but these are being kept extremely limited thanks to the proven processes that we have in place. So far, there has been no significant wastage of COVID-19 vaccines. The small proportion of doses that have been lost is lower than what we see in an average influenza season and is a testament to the steps that AHS has put in place. Every dose counts, and we want to immunize as many Albertans as possible. We will keep looking for ways to reduce waste as more vaccines arrive. I want to ask Albertans who see concerning facts online to please check those facts before sharing reports broadly, as rumors can spread and can be harmful. Turning to today's update. Over the last 24 hours, we have identified 843 new cases of COVID-19 in the province and completed more than 10,300 tests. Overall, our current positivity rate is about 8.2%. Our healthcare system remains under significant pressure, with 919 people in hospital, including 140 who have been admitted to the ICU. Sadly, 26 new deaths were reported to us in the last 24 hours. We have had more than 1,100 deaths due to COVID-19 in this province. My heartfelt condolences go to the family and friends of these individuals, and also to anyone who is mourning the loss of someone they loved. Over this last year, this virus has tested each and every one of us. The way we were used to interacting with each other and the world around us changed dramatically. This is a new year, but there is still a stretch of hard road before us. COVID-19 is still here and still threatens our health system and the well-being of our friends, family, and neighbors. We are seeing a stabilization in cases, with occasional days of low new cases due to lower testing volumes. But overall, new case numbers, hospitalizations, and ICU admissions for COVID-19 are still very high in our province. Similarly, while vaccines are arriving, shipments are limited, and it will be months before we will be able to offer immunization to the general population. While we work to offer vaccine to those at highest risk, we must continue to act as the vaccine for each other right now. Please keep following the public health measures in place and limit your in-person interactions whenever possible. That is the only way to protect our health system, protect each other, and limit the spread in the weeks ahead. Thank you, and we'll be happy to take questions.
To those on the line, we ask that you be brief, limit yourself to one question, and indicate who you are directing your question to. Operator, can you please put through the first caller?
Our first question comes from James Keller of the Globe and Mail. Your line is open.
Hi, this is a message for Dr. Hinshaw, although the minister might want to weigh in as well, the health minister. In the Premier's remarks last week on New Year's Day, he drew a distinction between guidelines and legal orders, and he said the critical thing really is these binding orders. So how do you think Albertans should view your voluntary guidelines, whether about travel or anything else? And do you worry that this kind of messaging will make it more difficult to rely on voluntary measures, as the province has for much of the summer, as the pandemic goes on?
We strive in the information that we put online from the office that I work with to make sure that the information is as robust as possible and as complete as possible with respect to those measures that will reduce our case numbers. So what I would say to Albertans with respect to when they're wondering, what they should do, I would say that there is a suite of legal orders. There's also very specific sector-specific guidelines that are referenced within some of those orders. And then there are the recommendations that we have on the site. And what I would urge all Albertans to do is to consider how they can adopt as many of those recommendations as possible while following, again, the legal orders which are non-negotiable, because, again, we really have to collectively work together to bring the spread down. I don't know if Minister Shandro.
Thanks, James. And I think the comments that you're referring to, the point of it is Premier was trying to take responsibility for those actions. But let's be clear, it doesn't matter who you are. All Albertans, whether it's an order, and as Dr. Hinshaw said, people are compelled to follow the orders. There is guidance as well. We ask all Albertans, regardless of who you are, to follow both the orders and the guidance. Thank you, James.
Operator, can you please put through the next caller?
Our next question comes from Rick Bell, the Calgary Sun. Your line is open.
Eric.
Good afternoon. And again, it's for Dr. Hinshaw, but if anybody else wants to weigh in, I'm sure we'll all be more than happy. Quite bluntly, with the messaging you've had over these months, Doctor, what is your reaction to the events of the past few days, the revelations that have come out in the past few days, the anger, the white-hot anger of Albertans about what's happened over the past few days? And we've just found out, by the way, that in Calgary, a person who is in favor of very strict health guidelines, Mayor Hinshaw, 2 members of his staff traveled to Hawaii. So with all of this on the front burner, Doctor, what is your reaction to all this? And you must also be hearing from Albertans and the absolute fury they have. And if Minister Shandro wants to weigh in, I'd be more than happy as well.
Well, thanks, Rick. And yes, I will provide some comments as well. I think the first thing to say is this, and you're right, people are angry. I've spent much of the last few days talking to constituents, and they are angry, and they're right to be angry. Look, and when I speak to these constituents and I hear them, I'm listening to them, I hear that anger, and I tell them that they're right, all I can say is this, I can say that we're sorry, but I'm not asking for their forgiveness. I'm trying to make that very clear. I don't think we can ask for forgiveness at this time. And I think what we can ask for, though, at this time, and what I'm asking from Albertans is patience. There was over 1 million Albertans who voted for us because we campaigned on hard work and humility. And some folks from our team forgot about that last part. It's not going to, with the accountability that occurred this week, it's not going to be turned around overnight. It is going to take us time to be able to earn back that trust, to earn back that credibility, and to show people that humility is still important for our team, our caucus, our party, and this government. That's what we're committed to continue to be able to show to Albertans, to earn back that trust, to earn back that credibility. Dr. Hinshaw?
Thanks, Rick. And I would echo what the minister said with respect to understanding why Albertans are so angry about this. I think what I would say about that is that we're all so tired. We're all tired of the restrictions. We're tired of COVID, and I think that sometimes. As you know, I often, when I've stood up here, have asked Albertans to be compassionate with each other when we all make mistakes and when we do things that we shouldn't do. And so today, like every other day, I'm going to say I can absolutely understand that anger. I also know that all of us, all Albertans, are really sick and tired of COVID. And sometimes that leads to lapses in judgment. And so I guess I would just ask Albertans to take a deep breath and continue to look towards that common goal of getting through COVID together, and knowing that we do need to look to that public health guidance, look to those measures as the roadmap that will get us through.
And Rick, maybe just one more thing to add is that I think the reason that we understand the anger is that many of us were frustrated too and angry too. And look, all of us are making sacrifices and have been for the last 10 months. There's nothing I would have wanted more on Christmas than to spend it with my parents, and I didn't. And, that sacrifice that my kids made to not see their grandparents for Christmas for the first time. And it's frustrating. It's tough for all of us making these sacrifices. And I think that's why people have been angry, and rightfully so. And I think that's why, but I guess my message again to Albertans is that it is working, and thank you for these sacrifices. So thank you for the question, Rick.
Operator, can you please put through the next caller?
Our next question comes from Kevin Nimick of CTV. Your line is open.
Hey, Kevin.
Stan.
First, when do you plan to announce if the current restrictions will be extended, and why are you celebrating using 56% of the current supply of vaccines? Is the goal not to do much more than that if the supply from the federal government is solid?
Thanks, Kevin. Sorry, the first question again, or maybe the first question was?
When do you plan to announce if the current restrictions will be extended?
The Cabinet COVID Committee is meeting again later on this week. We will be reviewing some of the data that we see from over the holidays. As I mentioned, I think Dr. Hinshaw has as well, that we have to be careful. Some of this, the reliability of some of the holiday testing has to be looked at in a particular way, because not as many people wanted to get tested during the holidays. But we're going to look at that data. We're going to be reviewing it either this week or next week. But these restrictions are at least in place until January 12th. And look, Kevin, we're proud on a per capita basis to have immunized more Albertans than any other country any other province than the province that's the size of Vulcan County. We are doing much better than every province because of the amazing work that our frontline healthcare workers, those registered nurses and those other immunizers are doing. And it's time for us to celebrate the hard work that those immunizers are doing to get into continuing care facilities, to take care of the most vulnerable, to take care of the workers there, and to get AHS employees in our ICUs and emergency rooms vaccinated. That's what we're celebrating, that hard work that they're doing. So thank you, Kevin.
Operator, can you please put through the next caller?
Our next question comes from Julia Wong of Global News. Your line is open.
Hi, this question is probably for the health minister, but if Dr. Hinshaw also wants to chime in. We've heard several times in the past that the province was prepared for vaccines. So how do you explain to Albertans why the staffing levels were not initially there for faster distribution? And how quickly will the province be able to scale up to 4,000 vaccinations a day, which is what the Premier had mentioned? And Minister Shandro, you said that there was another shipment in the air. So how many doses are in this next shipment?
Thank you, Julia. A lot of questions there. Let's see if I can remember them all. So, look, we did have the workforce capacity. As I said, and I think you asked this as well in the press conference that we had between Christmas and New Year's, is that a lot of this is numbers of shipments and the number of amounts that we're receiving of doses, being able to coordinate if doses arriving from Pfizer on one day and then the next day, or Moderna on one day and the next day, how many of those doses arriving when they're arriving are out of our hands. But we do have the workforce capacity, and I think that's proven by the fact that we, other than PEI, on a per capita basis, have more Albertans immunized, and we have more of the vaccines out the door than those other provinces on a per capita basis, as particularly if you look at our comparative provinces, and that's what we're proud of. Julia, you'll have to remind me again of your other questions there. Is that all right? Is Julia still on the line?
Yep, okay, honey.
Do you mind reminding me of your other question?
Yes. You said that there was another shipment in the air, so how many doses are in this next shipment?
Yeah, sure. I'll let Dr. Hinshaw answer that one.
So this week, the shipments that are on their way are Pfizer doses, and I believe we're expecting about 13,000 doses this week.
Operator, can you please put through the next caller?
Our next question comes from Jeff Black of 660 News. Your line is open.
Hi there. I just want to go back to the travel controversy. This question is for Dr. Deena Hinshaw, and if Minister Shandro also wants to comment. I just want to know how much damage this does to the public health messaging that you've been trying to get out for months now, and do you see this as a turning point where we could see unraveling of that work that has been completed?
What I would say is I think this, again, demonstrates that there are a lot of people who are very tired of the restrictions and people who are frustrated with neighbors and friends and people who perhaps took shortcuts or didn't follow all of the measures over the holidays. What I would say is that where we go from here continues to be our collective choice. Every day we're presented with a choice about how we want to react to our circumstances. And the choice that's in front of us today as Albertans is whether we continue to pick up our game and to care for each other by following those restrictions, or whether we choose to let this divide us. We always have that choice. But what I would encourage Albertans is to, again, understanding that frustration, that anger, to encourage all Albertans to, again, take that deep breath, look at our current situation, and say, where do we want to go? We can only do this together. And the more of us who work together to bring our numbers down, the more effective we'll be. So that's all I can say. I don't know. Okay, and I'll pass it over to Minister McIver.
Thank you for the question. I've been on the phone a great deal in the last several days, and I'm hearing from Albertans who are angry. Sometimes they're yelling, sometimes they're using hard language. And I guess the message that I would say to Albertans is, you have every right to expect good behavior and a high standard of conduct from your government. And Albertans get to judge whether government met those standards of good behavior and high standards. And from what I've heard, Albertans have said very clearly we have not met those standards. And what I have to say is our government agrees. So if you're yelling at us, interestingly enough, my message is thank you. There is no doubt in our mind we didn't get it right. What we have to offer is a commitment to get it right in the upcoming days, weeks, and months. I'm not asking anybody to stop yelling. I'm just saying we're getting the message. We're committed to doing better. We're not going to make excuses. The only thing that will make this better is a high standard of behavior and conduct on behalf of the Alberta government. That's what we're committed to doing. And Albertans will judge whether we make that standard or not.
Operator, can you please put through the next caller?
Our next question comes from Dylan Short of the Edmonton Journal. Your line is open.
Hello and Happy New Year to all. I believe this is a question for Minister Shandro. Today, the Ontario government committed to vaccinating all long-term care residents, workers, and essential caregivers in COVID hotspots in that province by January 21st. I was wondering if the Alberta government is able to make any sort of hard deadline similar to this, so whether we can get long-term residents or healthcare workers or whoever vaccinated by a certain date. And then also with the, I guess, Aloha Gate, as many people are calling it, there's been a lot of speculation that some of the members of government that left the country may have gotten vaccinated already, did some line jumping. I wanted to give you an opportunity to either confirm or deny any of these rumors.
Well, the last question first, it's not true. Nobody's jumped the line. Our vaccinations have been provided to long-term care residents and the staff there, and AHS staff. It's healthcare workers and those who are most vulnerable who are getting the vaccinations. Sorry, Dylan, the first question again, I don't know why my memory is, Dylan, do you mind? This is the third time I'm asking somebody to repeat their question. The first question again, Dylan?
Long-term care residents, workers, essential caregivers.
Oh, right, and the commitment, like Ontario? Right.
Yeah.
Thanks, Dylan. So just to remind everybody of our plan for Phase 1A. So Phase 1A was about 87,000 vaccinations, and it included some of our healthcare workers who are in ICUs and emergency rooms, but it includes 28,000 residents of long-term care. It includes 36,000 who are the staff of long-term care, and as well designated supportive living as well, and 12,000 home care workers as well. So those folks are included in 1A, and we've always been planning for 1A to be ending by the end of January. Now, these are numbers that, as I said, depend on when the federal government and the manufacturers can get us these shipments, and however quickly they can get them. That's the number one difficulty in getting vaccinations to Albertans at this time, and our commitment is rolling them out as soon as we get them in.
Okay, we have time for 2 more. Operator, can you please put through the next caller?
Our next question comes from Michelle Bellefontaine of CBC. Your line is open.
Oh, hi there. I have a question for both Minister McIver and Minister Shandro. Can you both tell Albertans the last time you left the province?
Yeah, thanks, Michelle. It was Labor Day. I went to BC. Mr. McIver?
Thanks, Michelle. For me, the last time I left the province, I believe, was November 5th. My mother is severely ill, and I went to Ontario to see her.
Operator, can you please put through our final caller?
Our final question comes from Nia Williams of Reuters. Your line is open.
Hi there. Has there been any hesitancy around people wanting vaccinations in long-term care, either residents or staff?
Well, I think we have been reporting publicly. There have been some refusals. Thankfully, Albertans have a higher interest, and we saw that through the seasonal flu. We saw more Albertans getting and wanting the seasonal flu vaccine than we have seen in previous years. Part of that is the hard work of our community pharmacists, who are able to communicate to Albertans the positives of taking care of not just themselves but their loved ones around them. So haven't seen any concerning numbers about the refusals at this time. We also do have some residents, it should be noted, in continuing care who may not have capacity to provide consent to the healthcare worker or the immunizer, in which case then we look to their loved ones to be able to provide that consent for them.
That concludes today's question and answer. Dr. Hinshaw will be back with another update on Thursday afternoon. Good evening.
Thank you, everyone. Thanks, Christine.